Episode 14: Ribavirin Resistance and the Risk of Mutation in Long COVID. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID 19. I'm your host Anushka, a genomic enthusiast captivated by how the intricate code of life shapes our fight against viral foes. Today, we are navigating a shadowy frontier. Could prolonged ribavirin use, like a double-edged sword, forge resistant SARS-CoV-2 strains, threatening those grappling with long COVID? Joining us to unravel this complex puzzle is Saakshi, a master's student in microbiology whose deep knowledge of microbial dynamics illuminates this viral challenge. Saakshi, it's a pleasure to have you here.
Thank you, Anushka. This is a critical topic, especially as we explore repurposing established antivirals for persistent conditions like long COVID.
Let's lay the foundation first. Picture antiviral resistance as a cunning viral escape artist, slipping through the traps of our medical arsenal. What is antiviral resistance and how does this elusive act unfold?
Antiviral resistance occurs when a virus mutates to reduce a drug's effectiveness. For ribavirin, which disrupts viral replication by introducing errors into the RNA, resistance means that the virus evolves mechanism in order to tolerate or correct these errors, akin to a proofreader fixing typos. This is most likely under conditions of prolonged drug exposure, suboptimal dosing, or in immunocompromised patients where unchecked viral replication provides ample opportunity for such adaptations.
Ribavirin acts like a saboteur, sowing chaos in the virus's genetic machinery with error after error. But could this very chaos enable the virus to outsmart the drug? Summarizing, we are exploring whether ribavirin's strength is also its vulnerability at the same time. Sakshi, how does this paradox play out?
You have hit the nail on head, Anushka. Ribavirin aims to induce lethal mutagenesis, overwhelming the virus with so many replication errors that it can no longer function. However, if the drug concentration is too low, it fails to eliminate the virus and instead increases the genetic diversity of the viral population. This diversity creates a fertile ground for mutations in the RNA polymerase or proofreading enzymes, potentially neutralizing ribavirin's effects and allowing resistant variants to emerge.
To gauge SARS-CoV-2's potential, let's look at its viral kin. Have other viruses managed to shrug off ribavirin's effects, like a seasoned warrior dodging familiar blows? What insights do we have, Sakshi?
Yes, Anushka. In hepatitis C, mutations in the NS5B polymerase have been linked to ribavirin resistance, reducing the drug's efficacy. Similarly, strains of Lassa fever virus and respiratory syncytial virus have shown decreased susceptibility after extended exposure. While ribavirin isn't typically the primary concern for resistance, these examples highlight the risk, particularly with long-term use or as a monotherapy, underscoring the need for a caution in long COVID application.
Now, focusing on our main adversary, SARS-CoV-2. Has it shown any signs of outwitting ribavirin in clinical settings? Summarizing, we are probing whether this virus can evade ribavirin's mutagenic assault. What's the evidence?
No clinically validated cases of ribavirin resistance in SARS-CoV-2 have been reported, but laboratory studies suggest its proofreading enzyme, NSP14 exonuclease may correct ribavirin-induced mutations as noted in SARS-CoV-2 antiviral therapy. This makes SARS-CoV-2 potentially more resistant to ribavirin than other RNA viruses. In immunocompromised patients with chronic infections, prolonged ribavirin exposure could select for polymerase variants that further reduce efficacy, a concern that warrants further research.
This raises critical questions for long COVID treatment. Should we tread lightly, like explorers in a minefield, to avoid sparking resistance? What does this mean for patients?
Caution is definitely essential, Anushka, if ribavirin is considered for long COVID, especially in long-term regimens. We must do the following, such as monitor viral sequences before and after therapy to detect resistance mutation, avoid monotherapy in persistent cases, favoring combination therapies to increase the genetic barrier to resistance, and use time-limited courses guided by biomarkers to ensure treatment efficacy and to also minimize resistance risks. Creating ribavirin-resistant SARS-CoV-2 strains would be a setback for the very patients we aim to help.
If ribavirin is a powerful but risky tool, how can we wield it without inviting resistance? Like a strategist outmaneuvering a cunning foe? Saakshi, what strategies can we employ?
Several approaches can help, such as combination therapy, in which there's pairing ribavirin with interferons or even other antivirals, as explored in Ribavirin, a drug active against many viruses, raises the resistance barrier by targeting multiple viral pathways. Another could be patient stratification, wherein treating only those with evidence of persistent viral replication, hence ensuring ribavirin is used where it's most effective. Another approach could be genomic surveillance, wherein there is routinely sequence viral genomes in treated patients to catch resistance mutations early. And the last but not the least would be dose optimization, like use doses high enough to achieve lethal mutagenesis but safe for the patient, balancing efficacy as well as toxicity. These strategies shift us towards precise, data-driven therapy for long COVID.
Saakshi, thank you for guiding us through this intricate terrain. Ribavirin's potential in long COVID is tantalizing, but we must wield it with precision to avoid forging resistant viral foes.
Absolutely, Anushka. Even time-tested antivirals demand respect for viral evolution, requiring precision and vigilance to maximize benefits and minimize risks.
Next time, we'll explore ribavirin's darker side, like hemolytic anemia, teratogenicity, and neurotoxicity. Are these side effects worth the risk, or do they render the drug impractical for chronic long COVID use? Until then, I'm Anushka. Stay critically curious.